Hi everyone, Dr. Remy from Pain Free and Fit. In today's video, we're going to be talking about the truth and nothing but the truth about leg raises and back pain. We're going to dispel the myths and clean up a lot of the misinformation that's out there concerning this exercise and how it affects your back. We'll be answering your questions: are leg raises good or bad for your back? Why does your back hurt after leg raises? And how can you do leg raises without hurting your back? Hope you enjoy. So one of the first things I explain to my patients as well as my online clients concerning back pain and leg raises is that it's a unique situation for each person. Leg raises are neither good nor bad for your back unless you understand what your unique issue is, and how you perform them has to be a customized version that meets your unique demands based on what's going on in your back. Is your back aggravated, for instance, with flexion, bending forward? Many people with disc problems have a tendency to slump forward at home, and exercises where they bend forward and lose the arch in the back, where the back flattens out, that's going to aggravate their problem because it's compressing the disc. Other people have a tendency where the tailbone tucks under and they have a flat back, and when they exercise, too much tail under or too much flat back compresses the discs by rotating the pelvis, again causing flexion or a loss of that arch in the spine. Other people that have problems such as stenosis, facet syndrome, spondylolisthesis, these problems are usually aggravated with too much extension or an overarching of the back. Here, when they leg raise, that overarching in the back compresses the facet joints, it compresses the nerves, it compresses the back portion of disc herniations and bulges, and aggravates their back pain. Other people have a tendency to have back pain when they lean sideways or back into the side. They compress structures in their back from a sideways or lateral perspective. They have to do leg raises differently, as well as other people who suffer from compression in their back. And what type of compression and what angle of compression is unique to them. So as opposed to going on to the painfreeandfit.com website and taking the full body analysis or learning how to analyze your body mechanics, your movement errors, your spinal stability issues, and muscle imbalances on any of our programs on painfreeandfit.com, we're going to go through a very modified explanation concerning leg raises, which is basically a flexion and extension exercise, meaning the body moves back and forth and we have to learn how to stabilize that, as well as occasionally a lateral component is part of the exercise and compression. So here we go. We're going to take it apart one by one in terms of these mechanical errors and explain how you can do your leg raises and modify them without hurting yourself. So first, let's address the common situation with leg raises, which is the advice of keeping the back flat. For people whose back pain is aggravated with extension, meaning increasing the arch of their back, such as people with stenosis, facet syndrome, posterior disc herniation sometimes, they want to flatten the back so they don't extend because arching hurts their pain. You have to try to determine if it's more of an arch because you're leaning backwards from the upper body. If you do that standing and as you lean back you feel back pain, you want to make sure then that your rib cage is held slightly forward. Now you can do that by incorporating a slight crunch, so you keep your rib cage forward and not backwards. Or you could do it passively with a roll or towel behind your shoulder blades. And also you could lift your head, because when you lift your head, the neck flexor muscles work with the abs to hold your rib cage forward. And as you perform your leg raises, you'll want to work more in an upper range of motion, because lower down, as you get towards the low part of this exercise, your rib cage is going to want to fall back. Momentum and the moment arm or the lever of your legs pulling down wants your pubic bone and ribs to separate. If you have a problem with extension or arching the back causing pain because the pelvis is tilted down, and here again you'd know that standing if you just simply tilt your pubic bone down and raise your tailbone to increase the arch. Here you want to make sure the pelvis stays tucked under the back flat. You want to make sure your tailbone stays under and your pubic bone up, so you're causing what's known as a posterior tilt of your pelvis. What will assist you with that, besides just holding that position with your abdominals, is you want to take your hands and place them underneath your tailbone. By doing this, you'll create a little fulcrum that will make that tail under easier, and as you perform these exercises, again, you want to use a higher range of motion, because the lower you go, you'll notice your tailbone wants to come up and the back wants to arch. So your ranges of motion will be more in the upper half of the exercise. You can do this with one leg. If you perform one leg raises, there's going to be less of a stress on the spine than two legs at the same time. Or you can bend your knee. By bending the knee, you're shortening that lever or moment arm of the leg. It's easier for you to maintain that tail tuck under position. The other thing you can do is use the opposite leg in flexion and place that foot on the bench while you do a leg raise. Here is a very safe version of keeping the back flat because I'm combining a number of these corrections using my hands underneath my tailbone. My opposite leg is up, which assists the pelvis to posterior tilt, and I'm using a higher range of motion. All of these help to keep the back flat. Remember, how much back flatness is due to your unique neutral spine position. If you don't know what that is, it's more complicated than what I'm going to explain, but if we just talk about a flexion and extension range or plane of motion, we could say that if we tilt the tailbone up too much or lean the back too much at a certain amount of arch, we're going to feel a little discomfort in our back. And likewise, if we tuck the tail under too much or bend forward too much, we may feel a little pull or discomfort in the back. So our ideal range of arch wants to be right in the middle of those two extremes that cause discomfort. If we hold that during our exercise with these passive supports, that's going to help avoid our aggravation. Another issue that's very common for people that have an anterior pelvic tilt, where their pubic bone is lower than their tailbone and arching their back by rolling their pelvis forward aggravates the back pain, is they have very overactive hip flexor muscles. Now, during the leg raise, you are using the hip flexion. That's the main part of the exercise. You're flexing your hips upwards. Your abdominals are used as stabilizers. However, to decrease the overcontraction of the hip flexor muscles, we can take our leg bone and we can pull it back into the hip socket. This will help to activate the glutes to stabilize the hip and to decrease the pull of the hip flexors so they're not over-contracting in what's called an anterior femoral glide. So as I do that, I'm simply thinking of pulling my leg bones back in the socket through my range of motion, and you'll feel right in front of the side of your hip bone, there'll be less tension in the hip flexors, more tension in the glutes, and you'll be using your abs to stabilize just as much, but without the overactivity of the hip flexor muscles. Too much hip flexion versus just enough is key many times to preventing back pain with leg raises. So now let's examine the opposite situation, where too much flexion or flattening of the back is going to aggravate our pain. Either when you're standing, when you lean forward, you feel pain, or if you tuck your tail under at a certain point of flattening the back and losing the arch, the back pain is aggravated. Here, in conditions such as disc herniations, retrolesthesis, instability of the ligaments, too much of a pull on the back of the facet capsule, you're going to get aggravated by losing that arch. So we want to maintain the arch. How much exact arch do we want to maintain? Again, we go back and forth, tilting our pelvis anteriorly, increasing the arch until we feel a little discomfort, and then posteriorly until we feel a little discomfort. And we want to place it right in the middle. Or if slightly tilting forward from the rib cage from the top aggravates versus leaning backwards, we want to go in the middle there. So we always want to get that arch in its neutral position. If we have more of a problem when we flex forward, in other words, bending the spine forward, sitting in slumped postures for a long period of time aggravates our back pain because our ribs come down. And flexion or loss of that arch from the top of our body is the issue. Here we want to make sure that we want to keep our rib cage in extension to maintain that arch. So the way we would do that is when we do our leg raise, as opposed to crunching down to think that we're going to overstimulate our abs, we actually want to lift the ribs up a little bit. So as we're doing our leg raise, we're maintaining a slight lift or extension of our rib cage as we perform our leg raises. We also want to use a range of motion that's lower down. If I keep the legs lower down during my leg raise, there's going to be a lot less tendency to flex the spine. The higher my range of motion, the more tendency it is to flex the spine and irritate. I can also use a passive support, such as a towel or a roll, underneath my lower ribs to raise my rib cage up and hold it there as I do this exercise. In either case, we're training the abdominals to contract by stabilizing the rib cage and the pelvis without the rib cage coming forward, as opposed to the common mistake of crunching back. Same thing with the head. If I have a problem with my torso bending forward causing flexion and aggravating my back pain, I want to bend my head back and take a gaze that's behind me as I do my leg raise. Here, the neck extensor muscles work with the back extensor muscles and help to support the rib cage in the proper position, avoiding the torso going forward and flexing. Now let's look at the bottom of this flexion problem. If I tuck my tail under too much and I feel my back pain, I want to make sure I maintain that arch by emphasizing the tail up, meaning an anterior pelvic tilt, where the pubic bone moves down towards the feet and the tail moves up towards the shoulder. That's going to be my protective tension or position I want to maintain. Now I can do that actively by simply holding my pelvis in an anterior pelvic tilt with leg raises, or I can take my hands, and as opposed to before where I put them under the tailbone, here I want to put my hands directly underneath the arch of my back. So it's supporting the arch. It's filling that hollow between the bench or the floor and my back. I'm simply maintaining that arch passively with my hands. This will help to avoid that arch disappearing as I do my leg raises. Again, if this problem exists and back pain is aggravated by losing the arch with too much posterior pelvic tilt flexion, I also want to work with lower ranges of motion. I want to work with my legs down here, because the higher my legs go with the leg raise that's up high, the more tendency it is for my pelvis to tilt posteriorly and aggravate my back. This is especially so if I have tight hamstring muscles or tight posterior chain muscles, because the tighter my hamstrings are, as my legs come up, my hamstrings are tight, my hip doesn't want to flex anymore. So what happens is my whole pelvis and low back starts to flex to induce the motion of the exercise. So I'd, in this case, want to stretch my hamstrings out, stretch my posterior chain muscles like my glutes or rectus spinae muscles out, possibly even the lats, before I do this exercise, so that I have proper flexibility in the hip and the pelvis, and the low back has less of a tendency to arch. But I still want to work at these lower ranges of motion, not as much up high, which is more of a tendency to flex. Now I can also use the leg support for this. If I take one leg and place it down, that helps to anchor my pelvis in an anterior pelvic tilt. And as I do a one-legged leg raise, I'm a lot less likely now to flex the spine. I can also use what's known as a deficit leg raise, where I scoot down so that my knees are off the bench and lower than my hips. Here, when I do my leg raise now, I'm a lot less likely to flex my spine, because my hip and pelvis has positioned an anterior pelvic tilt, and as I'm performing whatever range of motion I choose, it's further away from going high enough to cause flexion in my lower back. Now let's address the topic of lateral instability while doing leg raises. There are plenty of people that have one side where they either lean their rib cage to one side throughout the day, especially with postural habits that come out with exercise. You'll notice that these people have a tendency to shift to one side when they're exercising. Their abdominals and their back muscles, their lats, they're all stronger on that one side. That's a muscle imbalance that pulls them to one side. If you lean to one side and notice your back pain is aggravated while doing leg raises, the further the set goes on and the more you become fatigued, you will start to go into that side, just because that's your stronger muscle. That's what you're going to be relying on to complete the set. So here we want to make sure we keep that rib cage up and avoid that side tilting. If hip hiking, or raising your hip sideways, one hip up towards your shoulder more than the other, aggravates your pain, you have to avoid that hip hiking problem by keeping that hip shifted down as you do your leg raise. So in this case, let's say I have a tendency to lean to the right and hip hike on the right. As I'm performing my leg raise, I'm keeping my rib cage up and away from my hip, and my hip down away from my ribs slightly, perhaps 1/8 of an inch, while I perform my leg raises. Compression is another topic when it comes to leg raises and how it aggravates your back pain. Many people are aggravated with compressed spines while doing leg raises. While you're performing these leg raises, many muscles are working, including your psoas muscle, which attaches from the front of your spine into your leg, and the psoas compresses the spine. So if that is an issue, we may wish to do one-legged leg raises as opposed to two, or we want to do them in a lower range of motion, because the higher your legs go in a leg raise, not only do you have compression on the spine, but you also have flexion. And when combined, both compression and flexion together aggravate the disc many times more than they should. Another option, if compression is an issue for your back pain, is performing the leg raises hanging as opposed to lying down. When you hang, there's a vertical displacement or distraction, avoiding compression, so your spine actually stretches out a bit. You could try that technique and, again, work at lower ranges of motion. So before you attempt your next set of leg raises, go through a little analysis on yourself. See if bending forward or backwards from the top aggravates your back pain. If it is, you'll know how to plug in the recommendations made. See if increasing your tailbone or decreasing it changes the way your back feels, or perhaps laterally flexion or compression. If you sit for a long period of time, that's compressing the spine. Plugging these tips in can go a long way to helping you prevent injury to your back and enjoy your training pain-free, allowing you to enjoy greater levels of fitness. If you've enjoyed this video, feel free to subscribe to our channel. Got a lot of great tips out there to help you exercise without hurting yourself. Questions or comments, write in. As always, I'll do my best to answer. Thumbs up to help me share this valuable information with others. And remember, if you have questions, if you're looking for a great way to self-analyze your body mechanics as it relates to pain, check out our painfreeandfit.com website. We have plenty of programs on there that help you self-analyze your problem and construct a self-rehab routine to get you back into shape without aggravating your condition. I hope this clears up some of the many myths and misconceptions out there and helps provide some truth in your training for better gains with less pain.